but this is the one and done treatment that you then will not need significant maintenance after, except a little lasering, because we do everything then. So the next one that I think is a controversial one is under eye creams. So under eye creams are basically specific for the thin under eye skin. But the problem is that the other thing about the lower bleph is that obviously it's very personalized. So if you have a hollow underneath that area, it's going to make things look darker. So I will put fat in that area or transpose it into the cheek. That's the important part here. No matter what treatment you do, I always recommend that you use an eye cream before and after and just as maintenance. But if you were to use one eye cream for the rest of your life, it's okay. So there's a lot of treatments for the under eyes, and we talked recently about what my favorites were. And I want you to remember that everyone's under eyes are completely different. You could have bags, hollows, dark circles, I don't know, all the things. So I want to talk about my favorite ones and what impact they provide for you. So the first being a lower blepharoplasty. This is sort of like the bee's knees because we do everything during this treatment. I take fat out or reposition fat. I add fat under the cheeks. I add fat under the eyes. We'll laser, take skin out. So it treats everything that most people are concerned about, short of maybe just a little bit of genetic hyperpigmentation. Can't fully get rid of that. But this is the one and done treatment that you then will not need significant maintenance after, except a little lasering, because we do everything then. I still making sure that your skin is prepped with skincare, with retinoids, with all the things, and then making sure that your skin is maintained thereafter. But this is that treatment that is like the 10 out of 10. The other thing about the lower bleph is that obviously it's very personalized. So if you have a hollow underneath that area, it's going to make things look darker. So I will put fat in that area or transpose it into the cheek. That's the important part here, because we're volumizing, smoothing out, improving texture, improving contour, improving shadows. So everything that people are concerned about are gone. So for the under eyes, I'm actually treating everything with that surgery, right? We're volumizing, improving texture, improving fine lines, smoothing out that area, improving shadows, improving darkness, all the things that people use eye creams for or spend thousands and thousands of dollars well beyond what a lower bleph will do. So if you are a candidate, you may as well just save for that for when you're ready. In the meantime, there are some nice things you can do, but they won't ever replace what a blepharoplasty can do. So that's my second choice, is not just biofiller on its own, but combining a biofiller gel with multiple different growth factors, because I've had the best results there. People do PRF, people do PRP, and they'll inject the fluid underneath the eye. They'll get a temporary result, but it's really just not long lasting or that impactful in my opinion, because it has some limitations. So if you go on a bender and then get your PRP the next day, the quality will be so poor compared to somebody who, a fresh one that I do next week, or an 85-year-old person that has PRP that's just not in as good quality. So in order to optimize it, in order to sort of counterbalance that like quality of it, I will add other growth factors to it that smooth and brighten the under eyes. You still need multiple sessions, and we do have some good results that I can show you too. But again, I also almost always combine this with something like lasers or skin removal or something to give you the best possible result. But I wouldn't say that I would do it on its own. So the next one that I think is a controversial one is under eye creams. So under eye creams are basically specific for the thin under eye skin. But the problem is that there's so many moisturizers out there that can work really well under the eye. You can use retinoids under the eye, you can use vitamin C under the eye. Unless you're targeting something specific with an eye cream, so you're targeting darkness or you're targeting crepiness, I wouldn't necessarily invest in a particular eye cream. But if you are, there's some really nice ones that go on very well. They go on under makeup, and with continued use, you're going to see a small incremental improvement. My favorite types of eye creams are ones that give you an immediate result. So they brighten, they tighten the skin underneath, and then over long-term use give you a better result, because I'm just impatient. I want to see something now. And those types of creams tend to tighten under the eyes minimally. But the thing to remember, again, eye creams are topical treatments. You're not removing bags. You're not depuffing an area. You're not smoothing out fine lines or deep lines. You're definitely not filling anything with volume. So these like volufiline things where people are trying to put fat back in, total BS, does not work. Save your money. It's $10. There's no way it's going to do anything. And there's even studies on it are showing maybe a 2% improvement. That's not significant enough to see a result, nor can applying something topically increase fat cell production. So forget about that. So if you're worried specifically about hollowing, then I wouldn't do an eye cream. And so the thing to remember is that no matter what treatment you do, I always recommend that you use an eye cream before and after and just as maintenance. But if you were to use one eye cream for the rest of your life, it's sunscreen. Use sunscreen under your eyes. It will truly prevent degradation of collagen. It will truly prevent them from getting darker. So if you just can't stomach using an eye cream or spending the additional cost, use your sunscreen. The last two are tricky, and I'll tell you why. For many years, we were using filler under the eyes. It's not a terrible thing, but in a very, very small, narrow amount of people, under eye filler can actually look really nice. It can volumize that area, and it can provide some support to that under eyelid cheek area. The issue with under eye filler is you've got this big muscle that acts almost like a sphincter. It flexes and contracts. And because of that, you're very prone to moving that filler. So I dissolve a lot more under eye filler than I place nowadays, because through the years, people have just had poorly placed under eye filler, too much under eye filler, or just bad luck in that the filler has migrated. It's just not worth it in my opinion, because now fat is just so much easier to place under the eye. It can be done in the office, takes just a little bit longer, looks so much better, and will continue to improve the quality of that area, which is why for filler, I put it at the bottom of the list. And then last, just because I don't do these treatments, I don't think they're that great, is a implant. Now, if you go to a surgeon that does a lot of under eye implants, for example, with under eye treatments, you can get a really nice result. But because filler and fat are used a lot more frequently, implants have sort of fallen out of favor. But for the right person that has a very weak under eye area, so the bone is pushed really far back, implants can actually be really nice. They do have some risks associated with it, scar tissue. You can have extrusion where the implants come out. You can maybe need them out in the future. There's long-term healing associated with it. So they're not a bad option. They're just not my choice option. There are other surgeons that do a phenomenal job. This might be their first option or their favorite, but it's just not mine.